Hi, everyone. Welcome to Dean's Chat, where we discuss all things podiatric medicine. My name is Dr. Jeffrey Jensen. I'm the Dean at the Arizona College of Podiatric Medicine, and I'm also the host for the Dean's Chat podcast. This fall, we've been doing bonus episodes where we're highlighting students from the various schools and colleges of podiatric medicine. Today, we have 3 students representing the Des Moines University College of Podiatric Medicine and Surgery. All 3 are members of the American Podiatric Medical Students Association, otherwise known as the APMSA. I'd like to introduce each of them individually. Representing the class of 2025, Stephani Honzura. Welcome, Stephani.
Hello. Hello. Thank you for having us.
Oh, you're welcome. Thanks for being here. And also representing the class of 2025, Elizabeth Gajardo-Stitt. Welcome, Elizabeth.
Thank you so much for having us.
You're welcome. And representing the class of 2026, Pranati Chitta. Pran, welcome to join it. Welcome to Dean's Chat.
Thank you for having us.
Oh, you're so welcome. So one of my goals is having all of you on the podcast and discussing the Des Moines University College of Podiatric Medicine is to give prospective students an idea of what it might be like to go to school there. So with that in mind, I thought to get started, Elizabeth, would you mind sharing with our audience what podiatric medicine is?
Yeah, absolutely. So I would say that podiatric medicine is the specialty within medicine that deals with the diagnosis, treatment, and prevention of foot and leg disorders by medical as well as surgical means.
Very good. And Stephani, would you please share with our audience the educational pathway to becoming a podiatric physician?
Yeah, so we follow the 4-4-3 model, just like our osteopathic and allopathic colleagues. So we'll do 4 years at an undergraduate institution. We'll then go on to 4 years of medical education and training. And from there, we'll go into a 3-year surgical residency. And afterwards, there is an optional of a 1-year fellowship.
Very good. Thank you. Yes, fellowships are becoming more and more common and desirable for students after they finish their residency. So thank you, Stephani. To set the stage for the rest of the discussion, I was hoping that each of you could share your podiatric journey to date. And what I was thinking is tell us where you're from, where you went to your undergrad, how you found out about podiatric medicine, and then lastly, how you chose the Des Moines University College of Podiatric Medicine. Pran, would you mind starting?
Yeah, of course. So I'm from Dallas, Texas. And so actually Stephanie's from there as well. So we're both from the South. I'm from a small suburb called Irving, and I went to Coppell High School. And then from then I went to University of Texas at Dallas. And the reason I got into pediatric medicine was I had a friend sit next to me in my neuroscience class during my senior year of college. And she actually told me that she's applying to podiatry school, and she ended up going to Samuel Merritt. And I started researching what the school was. It was like very elementary research. And my older sister, she's currently a physical medicine and rehab doctor. And during my gap years, I was still looking more into podiatric medicine, shadowing under many podiatrists. My sister actually recommended I look more into the field as she noticed that she works with a lot of podiatrists in her field and noticed how beneficial it was to not only be a podiatric doctor, but a surgeon in itself. And then why I chose DMU specifically was I saw I saw the good outcomes, the high match rates, and I did already know someone who was going here and matched successfully. And she also convinced me to choose Des Moines over other schools.
Well, very good. We'll talk about the shadowing experience in a few minutes, so we'll kind of circle back around on that because I know that's important too. But thank you for that, Pran. Stephani, would you mind sharing your podiatric journey to date?
Yeah, so like Pran mentioned, I'm also from Texas. I'm from north of Dallas, so it's a small town called Denton. I graduated from the University of North Texas, and I'm kind of a non-traditional student because I had quite a bit of gap years before I pursued podiatric medicine. I knew I always wanted to be in the medical field, and in high school and undergrad, I really was set that I was going to be a pediatrician. Long story short, I only had patience for my nieces and nephews because once I did a shadowing experience, I was like, I don't know if I could do this every day in my life. And when I graduated, I just kind of started working as a scribe at the emergency department. And I did that for a few years. And my fiance at the time, he was going to be moving to Dallas to be closer to work because the commute from Denton to Dallas, 35 anywhere is just notorious for like crazy traffic. So he was wanting to cut down on driving time. And he's like, hey, do you want to move out with me? So I started job hunting and I found a job application for a scribe for a podiatry clinic. I didn't really know much about podiatry. I had gone through like a bit of time where I was applying, doing interviews and, not getting like any job offers and stuff. So I kind of did a quick Google search, looked at what podiatry was. I'm like, all right, I kind of knew it was about the feet, but that was to the extent of my knowledge. I applied, got an interview. They must have loved me because they offered me the job. And I started, I think it was right before the pandemic. So it was like, I got a really good deep dive into podiatry. Like I was working mainly with the head podiatrist, like the owner of the private practice. And she was like, the first 3 months are very brutal because it's a lot that you have to learn. She's like, it's very different compared to other medical fields where, with medical assistants, we're a little bit more tedious in our procedures and how we, like what we see typically. So I kind of had that in my mind, like, okay, it's going to be a rigorous training experience. But I think what I'm very grateful for her is she kind of took me on not only as like, oh, I'm training you as an employee, but like I'm also kind of mentoring you. So I got some shadowing there. And when I took my MCAT, I was like, I love what she does. She was, she owned her own practice, was a mom of 5, she pretty much ran everything how she wanted. I love that work-life balance she had. So I applied to podiatry school and I chose DMU. It was actually between DMU and Midwestern. They were like my top choices. And it really just came down to, I also had to like think of my fiance at the time, he was relocating with me and stuff. So, financials, cost of living and stuff like that. And I think what really sold me was at the clinic, we had hired a new grad, like a fresh resident who was a DMU alumni. And she was telling me about her experience and all the professors that she had at DMU. And it's just so funny because, she was telling me about Dr. Matz and Dr. Mahoney and all, Dean Smith, but, Dr. Smith at the time. And, she was telling me all these great funny stories. And I was so happy I chose DMU because I got to kind of relive and experience the great memories that she had as well.
Oh my gosh, that's a great story. Well, Midwestern's loss is DMU's gain. So congratulations. Elizabeth, do you mind sharing your podiatric journey to date?
Yeah, absolutely. So I grew up in Lincoln, Nebraska, so kind of right on the border there, close to DMU. For undergrad, I went to Nebraska Wesleyan, which is like the smaller private school in the capital of Lincoln. Growing up, I had always had a huge interest in medicine. I just wasn't entirely sure what field I wanted to be in. So through high school, I was involved in a lot of athletics, specifically volleyball and basketball. But my junior year, I was playing volleyball and I had a severe ankle injury. And very long story short, I saw a few orthopedic surgeons and none of them really got me back on the court. So kind of our last and final straw was a local podiatrist that was recommended by one of my mom's friends. And he quickly did an MRI and found out that there was 2 torn ligaments. So all the PT and all the things that I was kind of doing weren't actually getting me any better. They were just kind of at this plateau at that point. So seeing him really like made me interested in how specified he was in the foot and ankle and how intricate his training was and kind of how he was able to land on that diagnosis within the first appointment. So it sort of piqued my interest. About 6 months later, I did have to have a surgical procedure. And then after the surgical procedure, he actually offered me a job at his clinic. They were looking for someone kind of to work part-time after school hours, which was like perfect for me. They needed someone sort of from that 3 to like 6 o'clock time. So I started working as a medical assistant in his practice. There were 6 other providers there, majority of whom graduated from DMU. So that was kind of my first DMU plug. After like 3 or 4 years there, I had just kind of fallen in love with podiatry, the surgical aspect of it, the kind of communication and intricate relationship you deal with or developed with your patients, and then just how much of a difference podiatrists make in even just one appointment. I saw so many people like limping and in pain, and then oftentimes they would kind of leave with somewhat of a cure or something that they could try. So I really liked that part of it. So I kind of had sat down with them and I decided that I was going to apply to podiatry school right out of undergrad. So that's kind of what got me into the application process. DMU specifically, like I said, they kind of put that plug for DMU early on, just because 4 out of the 6 of them had attended DMU. So that was kind of like my first light bulb, I would say. Like Pran had said earlier, you know, the high board pass rates was really important to me, just knowing that I was kind of guaranteed a future after I invested all this time and finances. But then also something that really struck me as incredible at DMU was in our second year, we do a diversity and health series through Kaiser Permanente. And I believe that we're one of the only schools that have that diversity curriculum built in. And so I asked, that was like one of my big interview questions, like, what do you guys do at a school to promote diversity and inclusion? And it just seemed like DMU really had a lot of their curriculum dedicated to that and a lot of opportunities within there. So that was kind of, I guess, the final big check mark I needed to attend DMU.
That's great. You know, I noticed reading your CV that you've got some research in progress around the diversity.
Yeah. So Dr. Dykes, Dean Smith, and I, as well as 2 of my colleagues in my class, are kind of looking at diversity within the podiatric medicine curriculum at DMU, as well as many of the surgical books that people are studying from. And our research isn't finalized yet, but unfortunately it does look like we have a good ways to come as far as, especially in the dermatology literature and some of the surgical procedures, knowing kind of, what needs treated and what doesn't, as it looks so different in so many different skin types and tones. So, it's been really interesting to look at. And like I said, I think it's good for our profession to kind of realize where we have some of those deficits and what we can do in the future to work on those.
That's fabulous. Already contributing to the future podiatric medicine colleagues. That's wonderful. Thank you. So let's talk about shadowing for a second. Pran, do you mind sharing your experience with shadowing and its impact on your decision to go into podiatric medicine?
Yeah, sure. So actually, I also scribed in the emergency department before I started shadowing under a podiatrist, which inspired me further and which inspired my passion for medicine even further. And then I think one of the doctors I was working with, he said that his brother was a podiatrist or is a podiatrist. And so after I was doing research, I learned more about the field, also because, my doctor kind of asked me to consider it. And then I found a local podiatrist in Dallas. I think he was an Ohio alum, which is now Kent State. So back when it was Ohio. But it was very, it was eye-opening, a lot of it. Unfortunately, it was during COVID, so I wasn't able to go into the OR and specifically see any surgeries. But he kind of told me which one would go to surgery and which would just which wounds would heal on their own. But it was for his clinic. He did a lot of wound care and clippings. So it was interesting to see that, because I think that was my first deep dive, and then I think a lot of his were deep wounds where I could see tendon and bone. So that was kind of interesting to see. And then some I was are you sure you could this could heal on its own? And he was yeah, you'd be surprised, just not bearing weight and putting a boot on. So seeing all of that was very eye-opening. And then actually this past summer I also shadowed under a DMU alumni, and she was more focused on kind of giving more on the like injection side, like giving raw steroids for plantar fasciitis, stuff like that. So it was interesting. It was interesting seeing both sides of that. Whereas like she wasn't very surgical based, whereas the first doctor I shadowed, he was in the OR a lot of the time.
So did that impact your willingness or desire to be a podiatrist?
Yeah, because I think, just seeing that like a wound that's so like debilitating, be able to like be revived to an extent, and the patient is still able to kind of come back from it, and even if it is a toe amputation, like still live their daily normal life. It was very inspirational to see, and also seeing how there are many many facets and specialties within podiatry itself was also very inspiring. Not only like did I have to do surgery the entire time, I could mix and match kind of and choose when I wanted to do surgery, but I do have a passion for being in the OR.
Absolutely. Thank you so much. Now, Stephani, what a wonderful opportunity to scribe for a podiatric physician. So you knew what you were getting into from the beginning. What was your initial experiences, though, with seeing the doctors and their patient interactions, and what made you kind of say, hey, I'd want to be a podiatrist?
Yeah, I found it very interesting just because the way she laid out her weekly schedule, like Mondays were always, immediate post-op days. Her Fridays were surgical days. So I went in first day and I was like, oh my gosh, it was pseudo training as a scribe, but also kind of throwing me in as a medical assistant as well. So, I'm over there taking off the surgical bandages and I'm just like, am I allowed to do this? Because, scribing in the ER, you're like, don't talk to the patient unless you're doing some type of translation and stuff. But it was I really loved how hands-on I was from the beginning. And it was just interesting to see, the range of patients she saw. So, she was doing some flat foot reconstructions. She was seeing diabetic wound amputations. Wednesdays were notorious for her diabetic nail care days. So it was always like a good fluctuation of whatever came in the door. We also had those randoms of we don't know what we're expecting. And it was always, you don't say it's quiet in the office because then you are calling in all the crazy. I think just seeing how happy her patients were with the treatments that she was doing, whether it was, just clipping their toenails, me helping them put their sock and their shoes back on, those little things made such a big impact in these patients. And I think it was just so rewarding to see how, we are healing with our hands and getting people back on their feet and getting active again, was just very inspiring. And some pearls that she gave me was just if you're doing what you love and you're passionate about, your patients' interactions will be reflective of that. And I just saw how happy her patients were. And I'm like, I love this. I want this positivity. The shadowing I have done previously, I thought I wanted to do cardiology and stuff. And you just see all the deaths and stuff. And I'm like, I can't handle that. At least someone won't die specifically by the foot or because of the foot, there could if they go septic or something. But, usually there's a whole systemic cause of it. But I think just having that positive interaction and having that hands-on from the beginning was just really what had me committed to pursue podiatric medicine.
Oh, very good. It's interesting because so many students say one of the big impacts about podiatric medicine is when they go to shadow, they notice that the doctors they're shadowing are very happy and they're very content with their profession. And I always contend that's because there's so many options in podiatric medicine. Doctors tend to gravitate towards the things they like to do and that they're really good at. So it makes sense to me. And I hear the same story over and over from students that have shadowed. Now, Elizabeth, you had the firsthand experience of being a patient in being introduced to the profession. I understand that was great. Did you do shadowing? You really didn't have to do any shadowing because you took a job with that doc afterwards.
Yeah, I didn't really get to I didn't do much shadowing outside the clinic just because we did have those 6 providers who kind of like you had just mentioned, all kind of found their niche and what they enjoyed. So each day working, I mostly worked as a float since I just didn't have consistent hours. So I kind of got to see the variety that podiatry has to offer. So I think that was really beneficial. I did have the opportunity to go to the OR quite a few times. And I think that was really interesting as well. But even within that, kind of like Pran had mentioned, we had one doctor who specified in wound care. So a lot of the things I was seeing with him were, INDs or various amps or kind of like trying to do anything we could to limb salvage or make that possible, I suppose, as well. But then I would see other doctors who kind of, did mostly like sports med things, or we had a doctor who worked at the level 1 trauma center in the Lincoln. So he was mostly saying ankle fractures. So kind of being able to shadow them in the OR kind of gave me a different perspective as well.
Well, that makes sense. I wanted to shift gears just a little bit and talk about your leadership roles within the college and within the student organization. How did each of you get involved with the American Podiatric Medical Students Association, and what are your current roles? Because I always have students when they're coming into the college, they want to be involved, and I always find that the APMSA reps are involved in so many different areas. I was hoping you could each share that experience. Stephani, would you mind starting?
Sure. So I knew it was first year, and it was around, student, leadership or class leadership elections and stuff. And, they kind of, the second years gave a little bit of a snippet during orientation of like what their roles entailed and such. And I just found that the APMSA delegate was very unique compared to, class president or vice president and stuff. And it just really influenced me to want to kind of research more on what the position did. So, I went to online, and unfortunately at the time, our website was very lackluster and there wasn't too much information, and it wasn't updated back in 2021. But I got at least a good solid understanding of, how this national student organization are, we're here to protect student rights and, be the voice for anything that's happening and pertaining to our medical education and training. And I submitted that I was interested in running, and I was happy I won. I was very nervous just because, we were still very new with one another. I had only known the few people that attended in person in lecture, so I wasn't really too sure how I wowed people with my speech or not. But I was super happy that I had won. And at my first midwinter with APMSA, the APMA Board of Trustees Student Liaison elect position was opening up, and my predecessor was actually the current DMU third year. So I shout out Tushar. He kind of sat with me and was like, hey, like my elect position's opening up. And he kind of told me what he did, his involvement with APMA and the Board of Trustees. And I will admit it was a little overwhelming at first, just because he served on, I served on about like 4 APMA committees. There's monthly Board of Trustee calls, aside from like the monthly committee calls and stuff. So I was like, okay. And then we attend the 4 meetings yearly, aside from, the APMSA meeting. So I really thought it was going to be a lot to handle, but he's like, you'll be fine. I'm there as like for a year to kind of be your mentor and your guidance throughout the whole process and the transition. So I really have to thank him for, showing me the ropes. And he did leave me with some big shoes to fill, but I think I've been able to take on the role successfully, and it makes me super, it's bittersweet knowing that this next midwinter in Tampa, I will be getting an elect, and I'm going to be able to pay it forward and get a little mentee to kind of show the ropes for next year.
That's fantastic, and congratulations and great work. Pran, do you want to share your experience getting into APMSA and what your current roles are?
Yeah, so kind of similar to how Stephani described the APMSA delegate position, and that it's kind of more of the unique student leadership position. And I also saw that it was it would be my entire 4-year career during school. So that really motivated me to apply. And so like knowing that I would attend conferences and also meet other students from other schools, that also really motivated me to apply for the position. And I met up with Stephani a couple times, and she really encouraged me to do it, of course. And I think also like a big passion of mine is making sure that everyone's voice is heard. And something I did mention throughout my APMSA presentation when I wanted to be elected was that each student's voice in my class mattered, and that if they had any concerns, I could somehow be the connection with our class at DMU, class of 2026, and APMSA to kind of protect us and build a better future for us as podiatrists. And then what was the second question? Okay, I remember. Sorry. So recently I was nominated and elected as the interim APMA legislative liaison, as that role, as this previous student had to leave. But I've been kind of adjusting into that position, and it's been very enlightening. I am in the legislative committee for APMSA, so I learned a lot about that in the past year, about how what bills in Congress pertain to podiatry as a field specifically, and what we can do as students and through APMA to get those bills passed and to create more advocacy for our field.
Wow, and you just thought you were going to school to become a podiatric physician, huh?
No, really, that's what I thought. And I was like, oh, what am I doing now? No, but it's really like, it's honestly so eye-opening, because like I didn't realize the amount of like steps it took for this field to even come to this position. And, we still have a little bit more work to do in terms of in a legislative view, but we're making great strides.
That's great. It's always amazing how much work goes on in the background that, people don't even see it's being done, but it is being done, and it's being done by people that are willing to volunteer their precious time. So thank you. So Elizabeth,
yeah, of course.
Can you share your APMSA experience and what your current roles are?
Yeah. So my kind of, experience within APMSA is just a little different than Stephani and Pran, just because I am not an APMSA delegate for a current class. I actually decided to run for SGA, which is our student government at DMU, run for the presidential role. I kind of have decided to do that just because I always had a passion for leadership. In undergrad, I held a similar role. I was the student member on the board of governors there. So I kind of had always had this inkling that I wanted to do something in medical school as well. So I ran, and thankfully was elected. And within that role, part of our job duty, I suppose, is to attend the House of Delegates as a voting member, kind of to represent not only the classes, but the college as a whole, and kind of look out for CPMS there. So that's kind of how I got involved, and I'm very grateful to be a part of that. My role as SGA president and then going to the HOD is a little bit longer than usual, just because I took over as a president-elect a year early. So I've been there for almost 2 years now, which has been a great experience. Within HOD, I actually serve on the PR committee. So we do a lot with the social media, promoting this chat, actually doing, kind of the daily posts and all that stuff. So that's been really fun to be a member of that.
Very good. I'm sure I'll be seeing all of you at the House of Delegates meeting in March then, around the corner. Very good. Well, congratulations to all three of you. And I commend you. Not only are you taking on a tremendous academic curriculum, but you're also giving back to the profession at such a young age. And I'm sure that will continue for years to come. I always say it warms my heart, because I know the future of our profession's in good hands. So thank you very much. Let's talk about the educational experience at DMU. Pran, what I was thinking is you're the closest to that first year now. So would you mind talking about the first year experience at DMU and kind of everything from orientation to the kind of courses you're taking?
Yeah, of course. So I will say it's a very like utilized phrase, but it was really like drinking water from a fire hose for my first year. Like I mean, that's just not even, it's probably an understatement to be honest. And I'm like, yeah, but I don't know how I made it through first year. I'm still surprised. But during our first year, we do take, and I think Midwestern might be similar in this aspect, where we take all our classes with our DOS colleagues or osteopathic colleagues. So most of our classes, I think the only class we didn't take were principles of podiatric medicine, and they also have their osteopathic manipulative medicine class they take. So that was like one of the differences, but all our exams, everything was together. So I personally did like that because it built a connection between us. So now I have like a lot of DO friends that I can maybe refer consult with in the future, wherever they are. But I'm not going to lie, it was a very, very rigorous curriculum. It was very tough to get adjusted to. And we sort of were on this block system where each block was 8 weeks. Then we would have a break. So the entire year was 4 blocks. And each block was focused on a different course. And it was definitely, for me, what I found difficult was adjusting after each block. So we started with biochemistry in terms of foundational sciences with biochemistry, then transitioned to histology, and then transitioned to microbiology, pathology, and physiology. So transitioning for me was personally difficult because I had to find a new learning style each time. But it did prepare me for second year to kind of, predict the unexpected or expect the unexpected. And I do think that DMU does excel in that way. And our College of Podiatric Medicine, I think that's a very good idea to kind of start with a rigorous curriculum and then into second year. But I would say I learned a lot in my first year about like other specialties as well. Even through clinical medicine, we learned about OBGYN, how to do pelvic exams, etc. So it was enlightening of knowing how to do those things, even if I might not be using it in the future.
Very good. You're right. Our curriculum between Arizona and Des Moines is very, very similar. And I think it's great for the students to take classes with their DO counterparts. I think you learn from each other. You have a bigger pool to study with, but when you go into the podiatric medicine courses, you have your smaller group, and I think that everybody enjoys that. The 8 weeks go fast, though, don't they?
Yes, yeah. For us, between our 8 weeks, we get a week break, and I can tell you how much I enjoyed it. Like, it was so nice. It was the one thing I would look forward to, and it was just so rewarding. But like I said, I don't know how I made it through first year. It was definitely like drinking water from a fire hose.
Yeah, I think people describe it like that a lot, and it's accurate. And if it wasn't accurate, people wouldn't say it all the time, right?
Yeah, for sure.
So, Elizabeth, do you mind talking about the second year at DMU?
Yeah, absolutely. So second year, we do kind of merge into just our own cohort, So we start off with our clinical systems courses, and those last about 4 to 5 weeks each. We have GI, neuro, and then cardiology and endohem. So those are our 4 big courses. In addition to that, we do take pharm, which we kind of are now starting to incorporate with the classes this coming year. So I think that'll kind of be helpful. So while you're taking cardio systems course, you'll kind of be learning about cardio pharm. In addition, the first semester you take lower limb anatomy and, lower limb dermatology. So you kind of incorporate that as well. And then we do take that cultural competency course during that fall semester. And then you kind of have a reflection paper due at the end of that whole course. So you miss some of the block schedule, I felt anyway, because you don't necessarily have that built-in break. So it's a little bit more go, go, go. And you're kind of just pushing through until the end of the semester. But it is kind of interesting as you're able to build on the knowledge that you got from first year. So a lot of the first year, you learn the microbiology of the cardiac system or the physiology of the cardiac system. But then through second year, you kind of figure out, okay, how am I going to treat systolic heart failure? So it sort of puts the fact that you know about the systolic heart failure from physiology and the treatment from pharm kind of all together. So we have a lot of guest lectures during that time, just, that have the vast experience in that field. So Pran, if I'm not mistaken, I think that's all the courses. It's only a year ago, but it sort of feels like a long time. And then spring semester, we kind of do an even deeper dive into lower limb and kind of podiatric medicine itself. So we start in January, our in-depth lower limb anatomy course. And DMU does sort of strategically place that right near boards, as boards are 25% lower limb. So we kind of do a deep dive into that. We do have lectures, but a lot of our time's actually spent one-on-one with our cadaver in the lab. We're there probably 3 or 4 times a week for 2 to 3 hours. So we get a lot of lab experience, just learning about the lower limb and kind of all the intricacies that involves. And then we also have like a diagnostics course. So that kind of talks about all things podiatric medicine, and, x-rays as well as MRIs and what you need to order for labs, or kind of like learning how to go through like a differential diagnosis. And then we have a course that deals with biomechanics. And I think for everyone, that's kind of an eye-opening course. Today, actually, I was able to scrub and watch a surgery. And we were kind of talking about how far we came. Like last year at this time, we had no idea what varus and valgus even was. And even at the time that I took the course, I was still like, I don't think I'm ever going to understand how I can figure out if this calcaneus is in varus or valgus. And then today, when we were looking at the calc axial view, I could confidently say that we're not in varus. So it was kind of just interesting to see that, I guess, kind of come full circle there. But then after biomechanics, we have our big surgery course. And so that's a pretty rigorous course, kind of just all things podiatric medicine as it relates to surgery. And then we kind of go into taking boards. So we don't actually get like a specific break necessarily for boards as we go right into clinic. You can either do first clinic or second clinic at DMU, so you get a little bit of a break. If you take second clinic right away, and if you go first clinic, you have a little small break right before boards, but it's really only about a week or 2. So either way, you're kind of getting your feet wet in clinic and then studying for boards, which we take middle of July. So that's the best little synopsis, I guess, I can give of second year.
Oh, very nice. Thank you. So let's talk about boards prep just a little bit, because I always get asked that by students that are looking at going into podiatric medicine. Do you get review courses or little updates, or how do they structure that leading up to it? And Stephanie, feel free to.
Oh, yeah. Yeah. So I know, at least when we were taking some of our, what was it? In the spring semester, there was just, no, it was in our systems actually, during the fall of second year, like some of the faculty, like we have one of our pathology professors, Dr. Fong, he'd be like, this is boards, A++, like this you will see. So he kind of would always kind of plug in like, hey, this material will behoove you to look back on when you're doing board prep and stuff. I do believe in the fall of your second year, we kind of do a kind of a class review, more like you kind of sit down, they let you know that the resources on D2L for a course that you can kind of pseudo sign up for, but there's like the resources from past students and other classes who've put together Word documents, some Anki decks and stuff, PowerPoints, handouts and stuff, like whatever your kind of study method is, there's something in that folder. So we kind of do another little review kind of discussion in, I believe it was January, February-ish of our second year. And I kind of started studying probably after spring break. I would say study, but it was more, I was just reviewing sketchy micro and watching the videos and just hoping that the Anki was kind of going to stick in my brain. But I probably did like full grind once we finished like this semester in May. That's when I went really heavy. I had gone through all of microbiology. I was already halfway through pharmacology. Lower limb anatomy, I kind of we would dabble every now and then in clinic to review. But kind of what like my big and pretty much every upperclassmen always said was just like focused on the big three, being pharmacology, microbiology, and lower limb anatomy. If you have time to go through pathology, physiology and stuff, they're like, that's a little bit of extra bonus points for you. But they were like, those were the biggest three things that they focused on. And I kind of followed suit. But, once you get kind of closer to the date, you're just like, I don't know if I know anything. I know DMU, they provide us board vitals, so that question bank online. So I was doing those questions and stuff, and they're always kind of a little tricky. And whenever I was dabbling into the other subjects that I hadn't reviewed, that's when you were like, oh my God, we're like 3 weeks away. Do I have time to do a crash course of like pathology or something? But everyone's like, trust the process, you're going to be fine. And it's like, you have to listen to those, even though you don't want to listen to them. They're like, everything's fine, just breathe. You're like, it's not fine. But thankfully we passed, got the score in August because we had that delay and stuff. But It was very rewarding just knowing that everybody before us who kind of guided us and told us what to do, like their kind of tips and tricks and stuff, paid off.
Very good. And Elizabeth, did you have any unique experiences in studying, or what was your plan of attack going into boards?
Yeah, I think it was really similar to kind of what Stephanie mentioned. DMU did a really great job of kind of emphasizing the importance of lower limb. So I felt pretty confident in lower limb going into it. And then I knew I just needed to kind of fill in the gaps there with specifically micro and farm. DMU does offer an interesting kind of unique service, I think, through our CEE, which there's actually a individual who works for DMU that kind of specializes. He actually has a PhD and learning how individuals take boards, kind of for a lack of a better way to say that. But I kind of had sat down with him, and he can sit down with you and kind of make like a whole schedule. And so Stephanie had mentioned that sketchy is like really huge for people. And that's like a huge way people say to study. But for me, I'm not really a visual learner. So I was like watching these 20, 30-minute videos, and then I wasn't really taking much from it. So I kind of went and talked to him, and I was like, I don't know what else to do. Like, this is the way and the only way. And he's like, that's not true. We have, X, Y, and Z resources. So he's like, you're wasting your time if you're just watching these videos and not getting anything from it. So he gave me something called the Deja Review, which I found super helpful for farm. But there was just several paths that he kind of led me down. So I thought he was a great resource, to kind of, he even sat down and like reviewed my board vitals, and he's like, okay, so it looks like you're pretty strong in these subjects. Why don't you go over here? You need to hit this. I'd like to see this above 70% before you took the exam or something like that. So they were really good about that as well. But otherwise, I really agree with what Stephanie said. I think it was encouraging knowing, we kind of were going into it with high pass rates from the previous years. And we know that we kind of have a rigorous curriculum at DMU that does typically set us up very well, historically anyways, for taking boards part one. So although it seemed extremely daunting, and I remember the email I got when it pushed back a week, and I was like, this could not get any worse. Like, I just wish I knew. But like Stephanie said, I'm very grateful to report that it went the way it should. And the majority of everyone there was able to pass. So that's great.
Oh, that's great. And then DMU, their board passage rates speak for themselves. So congratulations to you and your faculty for preparing you for them. What I wanted to do is finish off the curriculum. Stephanie, would you mind talking about the third year? And then Elizabeth, if you'd talk about the fourth year, then we'll get on to a couple other topics.
Perfect.
Yeah, so third year, you really get into the deep dive of clinical experience. So after you finish your summer rotations, I think we all kind of come back. So you get into little small groups for the summer. And then once you become friends with those people, they put you in a different group for the rest of the year. So they put you in a larger group, and you're just kind of going around the different faculty members at the DMU clinic. You also have your SIM kind of trauma rotation. You have your community rotation. So you're following a podiatric physician in the local community, or if you have someone like out of state that you have connections with, you could have set that up too, because I think we have a couple of classmates who had mentors back home that they're going to be shadowing for that month. You also will do what else is there? Oh, the internal medicine rotation. So you're in internal medicine kind of. I just finished my internal medicine rotation, and it was very enlightening to know that I had DMU to prepare me first year. So I got to do a stroke eval, workup, and I had to go back and look at my clinical medicine notes and be like, all right, what were the exams for testing the cranial nerves 2 to 12? So I'm doing all of this stuff with the patient with my iPad in front of me, and I'm like, I hope I don't look like an idiot. But when I presented to the attending, she's like, you did so good. I'm so proud. She's like, you didn't freak out and be like, I don't know what to do. And I'm like, I knew I had the material somewhere from my education experience. So we kind of finish up through that third year. And then I think it's at least for our class of 2025, our first clerkship rotation starts in May of 2024.
Very good. And then Elizabeth, do you mind just kind of outlining the fourth year and what it looks like in terms of schedule and, boards, for example, and interviews for residencies?
Yeah, absolutely. So actually, we just finished about a month or so ago, kind of finalizing our clerkship schedules. So that is quite the rigorous process, trying to kind of figure out where you want to go, what you would like to end up at. We have a lot of presentations throughout our third year. Actually, first and second years can also attend the residency presentation. So they just come kind of give a snippet of what they offer there. You're able to attend, usually get a good free lunch, which is great. And then kind of can decide a little bit based on that, what it kind of looks like for you. So personally, my husband and I, we were ready to kind of spread our wings and go to the coast. So I mostly kind of applied West and East Coast to kind of see what that life is like. But we, like Stephani had mentioned, we actually leave in May and we never return to DMU until graduation, which I do think is a little bit unique. We have 4 chances or 4 different time slots, I suppose, to do what we call our core rotation. So that's a 3-month core at a designated program that DMU kind of contracts with to get not only podiatric experience, but we usually do some other type of experience. So for instance, for me, I'm going to do mine at West Penn, and I have 2 months on podiatric medicine, and then I have 1 month on burn and plastics. So kind of a burn plastics internal med month there as well. So like I said, you have 3-month slots, first quarter, second quarter, third quarter, fourth quarter to do that. And then the months that you're not doing that, you have the clerkships that you attend for a month. So like I said, those are kind of individually based on where you'd like to see yourself sort of end up in residency. And then we are required to do at least 2 additional months where we do a private practice month to kind of see how that operates, similar to sort of our community rotation in third year. And then we have to do another non-surgical month. So some people do internal medicine, endocrinology. There's a lot of different options. It just can't entail anything to do with surgery. And then if you'd like, you are able to also take in a vacation month. So sometimes people do that, April or May. You are also always provided the opportunity to do another clerkship if you'd like. So it sort of just depends on schedules. I think this year at the end of November, actually this week, I think some people start taking it tomorrow. So it's like end of November, beginning of December is when many people take part 2. It sounds like this year they kind of opened up a few more spots. And I'm not entirely sure if that's kind of a trial thing or what that's looking like for the next years to come. But I know at this point, there's 3 or 4 days people could take it. Interviews are also happen during fourth year, and those are kind of end of January, beginning of February time. I do believe this year is still in Texas, although I have heard talk of kind of moving that as well. So it seems like a few things are kind of up in the air for that, but you will tackle boards as well as interview. And then, of course, match is typically in that April time or April time. And then, we have graduation at the end of it all. So it's a pretty busy year there. But like I said, I think some of the unique things with DMU is kind of like the core 3 months, and then that we don't necessarily ever return to DMU campus in Des Moines. So
very good. Well, that's a thorough description of the curriculum at Des Moines. So I appreciate all of you chiming in there. So one of my favorite parts of doing these Dean's Chats with the APMSA reps is we talk about professor shout-outs. So if you don't mind, I'll give each of you an opportunity to shout out a professor that really made a difference in your educational process so far. Pran, you want to go first?
That's a really loaded question because I think all our professors are amazing. So it's really difficult. I don't know. I feel like probably my advisor, Dr. Kemp. I think, oh, Stephanie, were you going to say that? But I think he's always been like a really practical person. So he'll like the advice he gives you is just very practical. It's not like he doesn't try to fake reality. He doesn't try to sugarcoat it. A good example was, I was thinking of when to do research. I was kind of asking him like end of last semester, should I do it my second year or should I do it my third year? And I was kind of ready to do it my second year. And then I think it was during the summer conference in Nashville at APMA that he was actually there and he pulled me aside. And, even then he like was still, kind of looking out for me. And he was like, hey, are you sure you still want to do research second year? You always have third year to do it, when you don't have to worry much about didactics and your GPA, and just know that that's always an option. And so I think we had like an hour conversation at at the hotel about like what I want to, focus on for a second year and stuff like that. So ultimately he did, I took his advice to kind of focus on research in my third year. But I think that no matter what, he still has good intentions, like no matter where you are. Like it was, during summer when he didn't have to worry about, school or anything, he literally sat down with me for an hour and was telling me like what I need to focus on. So I really appreciated that. And, I just love like the kind of practical person he is. And he just gives it to you straight and what you need to hear and doesn't beat around the bush. So I really appreciate him.
Oh, that's great. Elizabeth, who would be your professor shout outs?
I think I really have to do two. I will make them quick, but during the first 2 years, I would definitely say Dr. Clayton. She taught us the cardiophysiology portion. Not only was she just an excellent, caring professor, but in times that I was kind of going through some personal struggles, she was always there, no matter kind of when, time of day. Specifically, I remember right before boards, July 4th, which was like 3 days before, I was just going through this spiral on how I don't know cardiac physiology and I'm so lost. And so I had messaged her a few days prior and she's like, Elizabeth, not a problem. Let's set up Zoom. So I was not even her student anymore. I had gone through 2 of her courses. She really had no real need to help me, especially on the 4th of July, which is an obvious holiday. But she sat down and took like an hour and a half, almost 2 hours, kind of just going through all the high yield parts for boards. And I think she would honestly do that for anyone at any time. So huge shout out to her, but also another huge shout out to my advisor, Dr. Dykes. She has just been an extremely powerful woman role model for me. Supportive, kind of like Pran said, no matter what you needed, what time you were kind of asking for that help. She was an honest source of information, but always kind of rooting for you to push yourself in the best way possible. So I think many medical students kind of go through self-doubt. I don't know if I'm good enough. I don't know if I'm qualified enough for this, but she always was a huge cheerleader. And I think just a huge supporter and just an extremely powerful woman in the field of podiatry. So it's an honor to be at her advisee. And it's hard to even choose those two, but there's many at DMU who I think could get shouted out all night long. So it's been an honor to attend that school.
Oh, that's great. Thank you. Stephanie, your professor shout outs.
Pran stole mine, but Dr. Kemp was my advisor too. He's just a solid man and I love him. I guess my shout out would be Dr. Donald Matz. He is our anatomy and physiology professor. And this man, his passion for the human body is just like out of this world. He had me so excited the first day of class that, that August day when we had to like kind of do a pseudo, it was kind of like a pseudo, not first day, not really first class, first lecture, but he just kind of instilled this very passion that I didn't know I had for, the entire body. And he was just there every step of the way whenever we were doing our cadaver dissections in lab. There was times where, you're following the lab manual to a T, but sometimes you accidentally cut something, do something a little different. You would think oh my gosh, I'm going to get in so much trouble. And he'd just be like, oh no, you're just doing a little remix on it. It's fine. Doing a new outlook on this. And he did that in our lower limb anatomy as well. And it was just so inspiring that someone, his love for anatomy just really helped my education in not only just a whole entire human body, but also lower limb as well. So I was just really great. I'm very grateful for him just because first year, whenever we were learning the brachial plexus and stuff, there was times where I felt very overwhelmed with, oh my gosh, our exams in 4 days. What do I do? And his open door policy is it is legit just swung open. I remember after a lecture, I went up with him. I'm like, hey, I just wanted to see if I can set up a meeting. I'm going to email you for later this week. And he's like, walk with me, talk with me. We'll go right now. And, I just sat with him and we probably talked about the brachial plexus for maybe half an hour. And then the rest, it was just us chit-chatting and stuff. And it was something I value all the time, just every time I see him on campus and stuff. So that would be my shadow.
Fantastic. Thank you very much. So I have one last question for each of you. What would you tell a student who's contemplating a career in podiatric medicine? Pran.
So I'd say it's the best of all worlds, not really both worlds, because there's so many specialties and you can literally pick and choose what you want to do. Surgery, you can do that. If you don't want to do that, you can stay in clinic. If you want to deal with pediatric patients, you can also do that. If you just want to do trauma, you can do that. It's just pick and choose what you want to do. And I love the variety and that there are as many options as you can think of.
Oh, very nice. Thank you. Stephani, what would you tell a prospective student contemplating a career in podiatric medicine?
I would just really tell them to not be scared to shadow local podiatrists in their hometowns. I was very shy, wanting to get some shadowing experiences, and you'd be surprised just even calling up their office, sending an email and stuff, how well responsive they are. And they're always happy to, bring in an undergrad student or even, anyone who's interested in podiatric medicine. So I would just tell them, reach out. And if you can't, APMA on their website has a local doctor set up as well. So if you're wanting to do some shadowing and stuff, there's that opportunity as well.
Thank you. And Elizabeth, I'll give you the last word. What would you tell a prospective student contemplating a career in podiatric medicine?
Yeah, I think Pran and Stephani gave excellent answers. I guess I would just say go for it. I think that a lot of people struggle with self-doubt and kind of being unsure, but I think that everyone in podiatry is extremely happy. It's an excellent career. You can kind of choose what you're passionate about and kind of find your niche within podiatry. Absolutely what Stephani says, find that opportunity to kind of shadow, dig your heels in, do some personal research. I think it's a field that is not as well known as others, but it offers excellent opportunities. So I guess kind of like Nike, just do it.
I like that. Thank you. Well, I wanted to let each of you know, I'm going to be sending you a Dean's Chat cup. Pran, I know you've got boards coming up, so you'll be able to use it. And I know Elizabeth and Stephani, with rotations and long nights and early mornings, you'll be able to use it also. So you look for that in the mail. And then to all of our listeners out there and people watching on YouTube, thank you so much. If you're watching on YouTube, please become a subscriber. And if you're listening on Spotify or Apple or Google Podcasts, please give us a 5-star rating. And until next week, cheers, everybody.